the reason that we try to get as many people vaccinated as possible is because there's always going to be people in the community that are too old, too sick, or too young to be vaccinated. So the rest of us get vaccinated to protect these more vulnerable members of society that maybe won't be able to get the vaccine for those reasons. And it's not just true for COVID, this is true for any vaccine.
Yeah. Mm-hmm.
So that's why, and so when enough people in the community have the vaccination, it will stop the virus from spreading in the community, and it will be less easy, like we said, for that virus to find a host. And we call that level of protection in the community herd immunity. And this is really a vaccine concept that, and we've had threats to our herd immunity for diseases like measles because there's a lot of vaccine hesitancy that's been arising in the last 20 years in the U.S. And I'm sure there too.
Yeah.
I just know about it here. So we're really hoping to do kind of a good education campaign around this COVID-19 vaccine because we already know the long-term effects of COVID can be very severe. We've got, respiratory complications, renal complications, cardiovascular complications and who are they happening to? Otherwise healthy people who were healthy enough to survive the virus in the first place, right? And we are only just now scratching the surface of what we know about the long-term effects of COVID. So making sure that we're vaccinated and protecting those vulnerable members as well as ourselves is going to be important. Oh, and the percentage, you asked about the percentage.
Yeah.
So I've seen estimates about 70% of the population is what we want for a target goal. That's that would be great if we could get that.
And density wouldn't change.
More would
that.
be more would. And then what?
Density, so how Australia's really.
Oh, density, right? Yeah. So, interestingly, this virus has such a large reproducibility factor. So, COVID is very, very contagious. It's more contagious than flu and some other not as bad as measles. That's the worst one.
Okay.
But it has a very high, what we call it the R naught value in epidemiology, but it's basically how many people one person is expected to infect. And with COVID, it's a pretty high number. And so we weren't expecting, in fact, in the rural areas of the United States right now, COVID-19 is rampant. And that has nothing to do with density. It's really kind of odd. And it didn't really need to be that way because it started in the cities in the U.S., spread in the cities badly, and then sort of moved its way out to the rural areas. And, not coincidentally, the rural areas in the U.S. are also areas that are resistant to mask wearing and mitigations and things like that. So, I mean, that's very highly correlated. For example, the Dakotas in the U.S., North and South Dakota, are they have the highest death rate from COVID-19 in the world when you adjust it per capita. And they're very resistant to mask wearing and reluctant to participate in public health. So it's very frustrating. So it really has, like we said before, the virus spreads when people are passing it from person to person. Where that happens frequently is in gatherings, in events, in, clusters. We know this disease happens in clusters, super spreader events, parties, in-home gatherings, church services, anything like that. So it doesn't necessarily have to be in a big city to be spreading. Does that make sense?
Yeah. I think you've pretty perfectly described our town because our town is pretty rural and there's a lot of people suddenly became asthmatic when they got the out of.
Oh, exactly. Yes. And, yep. And what's interesting is an asthmatic person you would think would want to protect themselves more because it's sort of like an autoimmune disease that you'd want them to protect yourself from the virus more. Like my mother is asthmatic, very severely asthmatic, has been all my life, and she always wore a mask. Like when we went on planes and when we would go to church in like the winter, she would always have a mask on, and I would be embarrassed, and I'd be like, "Take that off, Mom," you know. And when I was a kid, because I was like, "What are you doing?" Like, because no one wore masks, right? And I'm an epidemiologist now, but when I was a kid, I'd be like, "What are you doing?" But she always wore masks to protect herself because she knew that she could have a very bad outcome if she got a respiratory virus. So that's why it's very ironic to me that asthma is used as the excuse, because my entire life it was used as an excuse to wear one.
Yeah, I've got asthma as well, and I've always worn a mask, and I've never had any issues ever. So to hear people saying, "Well, I've got asthma, I can't wear a mask," I'm like, that's not a very good excuse.
No, there's really, I mean, I'm not going to minimize people that have had like trauma and have hard time wearing, but that's, you know, obviously I have empathy for those people, but when you're in public during a pandemic, you need to participate in public health. And if you can't participate in public health for whatever reason, then you really shouldn't be in public. Yeah,
that's another thing. Like, you would think people that are struggling so much to wear a mask that they can't breathe, they shouldn't be out. You would imagine.
Yeah. That's kind of. I mean, and when I say that, people think I'm being very harsh. Like, well, just don't be in public then. But we're not in a normal time right now. Yeah. And if you can't wear a mask, then you need to figure something out and stay home, because it's getting out of control with that stuff.